So thank you. It is really such an honor for our program to be recognized for the Award for Excellence in Medication Use Safety. I first want to really thank ASHP for creating this award, especially to honor pharmacists and all the hard work we do in promoting and leading our profession. I also wanted to thank the Cardinal Health Foundation for sponsoring this award. So I was looking back and kind of remembering a little bit about our on-site visit, and one of the things that really stuck out was when I was preparing for the visit, I was putting together a binder of all of our guidelines and protocol and data, and I remember having my office floor just full of papers. I had papers everywhere, just strewn about, and I paused for a moment thinking, all these papers on the floor, look at all the things that we really have accomplished in these past 2 years. And it really sort of hit me at that moment. Wow, our program really has done such great things just over a short period of time. And of course, I want to thank the entire anticoagulation stewardship team for making that happen. Without our amazing team of pharmacists, physicians, and nurses, I wouldn't be up here this evening. One key member of our program that I do want to introduce and personally thank, who's with us tonight, is Dr. John Hoke, who's over in the corner. I'm going to wave. He was on the video. He is our physician champion and also chairs our inpatient anti-coag committee. And Dr. Hoke and I, one of the first programs we really worked on was that VTE prophylaxis program that you saw all of our great data for. And actually a quick update, so our VTE events have now gone down to about 4.7 events per 1,000 patient discharges. So we've gotten even better since we made that video. But really, he's been a really integral part of our program. It's so great to have such a strong physician role in a team like ours. Another person who's with us tonight that I wanted to introduce was Kate Simonson. If you wanted to wave, Kate. She is one of, last year she was a PGY1 resident, and she worked with our group on implementing an inpatient warfarin management program for pharmacists. And I called her out, she didn't know I was going to do that, but just because in our pharmacy department we just find it that we're really responsible for making sure that our residents participate in projects that are really meaningful to both patients and to our hospital system. I also I want to thank my co-partner up here, Philip Chaskin. I want to call out Steve Rao, who's our Director of Pharmacy. They really were the ones who developed the concept for this program, so I want to say thank you for allowing me to participate in this program. Not only did they develop the concept, but they also worked on funding for the program, and they really do continue to support our initiatives. I also want to introduce Tim Galliard, who's with us today as well. He's our Vice President of Professional Services. We're so lucky to have him here today. We're glad that he came out. We're also really lucky to have a hospital administrator who is really, again, very supportive of the pharmacy department and then also of our anti-coag program as well. So thank you. And finally, I do want to thank our on-site reviewers. So I know Bob is here today. Aileen Killen was not able to make it. But we really enjoyed them coming out to see our site. Not only for just the award nomination, but also the idea sharing that happened during that site visit. So we really did appreciate that. And then also I do want to thank Dan Koba and Louisa Hart for creating that amazing video. So thank you, you made us look really good. And then finally I do want to congratulate the University of Michigan and Kaiser Permanente for your nominations as well. It really is an honor to have our program award or nominated next to programs that are as prestigious as yours.
Well, there's kind of this saying at the Badger football games when you say Wisconsin. Ann really said it all, but I just want to add a couple quick things. I'd like to again thank ASHP Foundation and the Cardinal Health Foundation for supporting this award. It's really cool to have an award where people are competing to make medication safety better. And so the real winners are the patients and the outcomes that are changed from these types of programs. And it's really fun that they're recognizing programs that are using the full breadth and depth of the healthcare team to make that impact happen. And so I think the more people that can shoot for these things, the better we're all going to be as a society, and our patients are really going to be better for it. So thanks so much for the opportunity to be here, and it's been a pleasure to